The news at noon starts right now.
The coronavirus crisis now affecting San Antonio in a major way. The party with a purpose now postponed. Fiesta will take place in the fall now.
All that happening after another major announcement this morning, a health emergency declared in the city of San Antonio. The city now confirming the first travel-related case of coronavirus in our community. Officials emphasizing the new coronavirus case is not an example of local community spread, but wouldn't specify anything about the individual or where they've been. They're only saying that the person is in stable condition and that they're with their family in isolation. Devin Clark was there as the mayor and the city officials held that press conference this morning. He explains that officials are now urging precaution, but not panic. We start our team coverage on the coronavirus crisis in San Antonio with Devin.
Well, Ursula, even at that press conference this morning, we all were seated feet apart from each other. The mayor stressing that prevention and containment are important goals, and he also offered this reassuring message that we will get through this. Now, this positive test result just came in late last night, which is why there are still so many questions to be answered. Limited details, but officials say an epidemiology team is working on tracing the infected person's steps and weighing public risk. Today, the mayor issuing a public health emergency declaration since the one from March 2nd expired after 7 days. There is an upcoming council item to vote on whether to extend this current declaration for a minimum of 30 days if need be once this one expires. Now, the declaration includes preventative guidelines such as recommending against large crowds of 250 people or more and prohibiting crowds of 500 people or more. Currently, there are exemptions, though, for establishments such as schools, hospitals, and churches. But the precautions stretch across local agencies. County Judge Nelson Wolf and the Bexar County District Attorney Joe Gonzalez speaking about assessing cases of nonviolent offenders and possibly releasing them from jail on personal recognizance bonds to reduce the jail population. Along with that, the courthouse will also have a reduced population as jury summons have been suspended until the end of April. Some trials will be put on hold as well.
On the civil side, all jury trials have been suspended. On the criminal side, we're going to have jury trials where there are time limits and speedy trial issues, and also to any type of emergency hearings. I have been designated to hear the quarantine cases of coronavirus here in Bexar County, and those require jury trials. So there could be jury trials in the interim. We will have to figure out how we're going to be able to summon jurors for those particular trials.
Metro Health officials say that they are working on a new criteria for COVID-19 testing, which, of course, must be given at the recommendation of a healthcare provider. In the meantime, they are urging people who do have symptoms of COVID-19 to call ahead to your healthcare provider or an urgent care if you don't have one. They advise not to go to the ER to help protect healthcare workers and others. And, of course, Metro Health's website will be providing updates. We also will have updates on KSAT.com. Stay with us on air and online for the latest. For now, reporting live outside of City Hall, Devin Clark, KSAT 12 News.
Thank you, Devin. Certainly a historic day in the city of San Antonio. Again, the city issuing a public health emergency. It prohibits large gatherings of 500 people or more, and that has left a lot of people wondering about Fiesta.
The mayor, the Fiesta Commission, and city leaders gathered outside the Fiesta Commission headquarters on Broadway to announce the city's biggest party. It'll be postponed until November 5th.
Max Massey joins us live from where that announcement was issued. So, Max, what was the biggest takeaway from that news conference?
Well, the Fiesta Commission emphasizing that importance of culture, tradition, and of course, that $340 million of economic impact on San Antonio. But at the end of the day, the city leaders believe that all pales in comparison to the health of our community. So let's take a look at what we saw earlier this morning. Now, we heard from a variety of city leaders, and we learned since its introduction in 1891, Fiesta has been celebrated every year except 1918 during World War I and 1942 to 45 during World War II. As of now, Fiesta 2020 is not canceled. It is simply being pushed back. The mayor says the fall timeframe was selected to provide enough time for the coronavirus pandemic to subside. Now, this will be jarring for a lot of companies, a lot of venues and organizations, but Mayor Ron Nirenberg telling me he has confidence San Antonio can come together and be just as strong in November.
This is a community that helps each other out, and so people understand that this is a party with a purpose. It affects a lot of nonprofits. So I think what you're going to see is a lot of private sector and community-wide support of these nonprofits in the meantime to make sure they can, continue their vital missions.
The Fiesta Commission's executive director says each Fiesta event is organized and run by a different nonprofit, and the meeting set for this afternoon will address the specialized needs of people who have already purchased those tickets. Now, the mayor adds that this is a proper precaution that we need to take. He wants to warn everyone to be safe, advising wash your hands, and he hopes that we can all get back to normal as soon as possible. David, Ursula.
Thank you, Max. And we should mention that one of those organizers, nonprofits for Fiesta, has already announced that they will cancel their event altogether, and that is Oyster Bake with St. Mary's University. Right now on KSAT.com, you can find that information as well as a look at all the events and attractions that have already been affected by the coronavirus crisis, including Six Flags Fiesta Texas, which is shutting down until the end of March. That starts tomorrow. Again, you can get a list of the latest updates on KSAT.com. Just click on the coronavirus section at the top of the homepage.
And we know you have a lot of questions about coronavirus, and we want to do our part to help keep you informed, and that's why we're answering those questions as part of our latest SAQ segment. Many people have already submitted questions on KSAT.com, and we've reached out to medical professionals for answers. We'll bring you that during the live stream this afternoon at 2 o'clock.
During the press conference this morning, the city of San Antonio recommended downloading an app. It's called the Ready South Texas app. You can put it on your phone. There you can receive up-to-date information regarding the coronavirus, the current state of the city, and emergency push alerts that affect where you live. You can download that app, the Ready Texas app, in the phone's app store on your phone. And a reminder that San Antonio Metropolitan Health District has opened a hotline. It's for anyone in Bexar County who has questions about the coronavirus. The phone number to call, it's on your screen. It's 210-207-5779. This hotline is open weekdays from 8 a.m. until 5 p.m. It's available in both English and Spanish. Again, the phone number, 210-207-5779. For more information as well, just visit KSAT.com.
American concerns about the COVID-19 virus growing by the day. New York State talking about new containment zone.
This afternoon, President Donald Trump is set to address the nation about the coronavirus crisis. That is happening at 2 p.m.
Meanwhile, Italy's death toll continues to rise. ABC's Megan Tavrizian is in New York with all the details.
New York State opening its first drive-through testing site outside New Rochelle, the site of their largest outbreak.
This is a new situation, so by definition, you're going to see new and different responses to it, and that's what you're seeing here.
The suburb just north of New York City, an active containment zone. Parts of New Rochelle closed down for cleaning. Fears about the impact of the coronavirus causing people to frantically buy food and supplies. In California, COVID-19 testing still hard to come by. Governor Gavin Newsom complaining about huge problems with the state's testing kits. There aren't enough of them, and most are missing key components.
I am surprised this is not more of the national conversation. We need to focus in on these tests.
Americans at airports across Europe rushing to leave as President Trump's European travel ban goes into effect.
I want to get back to the United States before I have to be put in quarantine or something like that.
In Italy, where 60 million people are on lockdown, the death toll now climbing past 1,000. Some experts say they haven't reached the peak of the outbreak. One of the nation's top infectious disease experts, Dr. Anthony Fauci, reminding Americans it could be weeks before this is over.
What's your message? How long are we going to be living like this?
You know, it's going to be at least a matter of several weeks. I mean, it's unpredictable, but if you look at historically how these things work, it'll likely be anywhere from a few weeks to up to 8 weeks.
Megan Tavrizian, ABC News, New York.
We want to head over to a little local news, the latest on a deadly shooting on the far west side. That victim has now been identified. The Bexar County Medical Examiner says he is 14-year-old Michael Paul Preto. The sheriff's office says he died after he was shot in the head at a home in the 11,500 block of Sangria. Officials say that David Rodriguez Jr. has been arrested for manslaughter in the second-degree felony. Police have not yet said what led up to this shooting.
A day-long standoff in Cibolo ends with a man in handcuffs. Police say the standoff ended peacefully late last night. 34-year-old Evan Robert Ford was taken into custody. Officers were initially called out to the 200 block of Willow Blood yesterday afternoon. The person who called him needed help getting back into a home after someone else locked it from inside. Police say the suspect fired a single shot at one of the officers at the scene. He faces a charge of attempted capital murder, and more charges may be pending.
A man is recovering in the hospital after he was shot multiple times overnight. San Antonio police say it was just after 12:30 this morning when a 40-year-old man was shot at the Quality Suites on Southeast Military Drive. Police say he was parked in front of the hotel next to another vehicle when those shots were fired. The gunman fled soon afterward. A person working at the hotel called it in, and the victim was transported to SAMC.
And a San Antonio police officer taken to the hospital overnight after running into the side of an 18-wheeler. Police say their fellow officer was traveling southbound on AT&T Parkway when he ran into the side of the big rig. He was taken to the hospital with minor injuries, a possible dislocated shoulder, but he is expected to be okay. No other injuries were reported. And happening right now, Governor Greg Abbott holding a press conference. He will be talking about what the state is doing to fight the spread of coronavirus.
We are monitoring this news conference. He is expected to speak along with Texas Division of Emergency Management Chief Nim Kidd, as well the Texas Department of State Health Services Commissioner John Hellerstedt. We're going to keep an eye out for new developments from the state. We will bring them to you throughout this show. We'll be right back.
Never miss a story. Watch live or when you want. San Antonio's latest news and weather. Streaming free on KSAT TV.
And once again, happening right now, Governor Greg Abbott holding a press conference talking about what the state is doing to fight the spread of coronavirus.
It just started, and there are a number of people still speaking, going to be speaking with him, and we are going to dip in and let you listen in for just a moment.
Division of Emergency Management to coordinate the state response to COVID-19. DSHS and TDEM also work with other state agencies, local health departments, as well as healthcare providers across the state. On January the 24th, DSHS began leading daily calls with public health authorities, healthcare providers, city and county officials, as well as school districts. On January the 31st, DSHS activated the State Medical Operations Center. Last week, DSHS announced that 10 public health labs in Texas are now equipped to perform COVID-19 testing throughout the state. DSHS has established a website for COVID-19 to share up-to-date information. It'd be helpful if you get that out. It is dshs.texas.gov/coronavirus/. Again, it is dshs.texas.gov/coronavirus/. Now, the state has also asked health insurers and HMOs operating in Texas to waive costs associated with the testing and telemedicine visits concerning coronavirus. We have a long list of health insurers that have agreed to comply with that request. Very importantly, for the uninsured, if an uninsured person needs testing for coronavirus, there are two options. One is a public health testing or private laboratory testing. For public health testing, it requires consultation with local health departments. If the person meets public health criteria, then the person is eligible for testing through public health testing with no cost to the person. Private testing can also occur, but there could be a cost to the individual. If people need to find a local provider, they can call 211, which can direct them to low or no cost providers in their area. As far as Texas schools are concerned, the TEA and Commissioner Mike Morath, they work daily with school districts to prepare the appropriate response for any particular school district. Commissioner Morath has begun leading daily calls with superintendents. Very important to note, Texas is seeking waivers for federal regulations for the school lunch program to give districts flexibility to provide students food should the district need to shut down for a temporary period to respond to the coronavirus. Now, some information about numbers where we are today. And understand they constantly change. But at this time, not counting the people who have been repatriated into Lackland Air Force Base, Texas has 39 confirmed cases in Collin, Dallas, Tarrant, Fort Bend, Gregg, Harris, Montgomery, Smith, Bell, and Travis counties. 220 Texans have been tested in either Texas Public Health Labs or by the CDC. And we currently have approximately 75 Texans who are being tested as we speak. Texas, some important facts I want you to make sure you get. Texas Public Health Labs have the capacity to test 273 people per day currently, with that ability to increase, also with private labs coming online. Importantly, next week, CPL will be able to test several thousand per week. In addition, there is LabCorp and Quest Diagnostics that provide testing. I'm also pleased to announce something that's happening as we speak right now. It's the first drive-through testing facility. I'm pleased to announce that Mayor Nirenberg in the city of San Antonio and his team are opening the first drive-through testing facility in Texas. This has been a swift advancement with the combined effort of the city of San Antonio City Manager Eric Walsh, Metropolitan Health District Director Dr. Don Emmerich, Fire Department Chief Charles Hood, Southwest Texas Regional Advisory Council Executive Director Eric Epley, UT Health San Antonio President Bill Heinrich, and University Hospital CEO George Hernandez. This facility is opening at this moment. It will initially be for first responders, healthcare workers, operators of critical infrastructure and key resources, and certain high-risk patients. Since they've only been open quite literally a few minutes, it's too soon to tell how many people they will be able to test each day. My team is also working with the cities of San Antonio and Dallas and is in conversation with the city of Austin to also implement drive-through testing sites that will also be run and managed at the local level. I expect and anticipate that at least 2, if not all 3 of those cities will be up and running next week or the week after that. Our local leaders and partners know their communities best, and I appreciate their swift action in providing these facilities. Well, as the situation continues to unfold, Texas is taking additional action to mitigate the spread of the virus and to protect the public's health and safety. To ensure that the state of Texas and our cities and counties are fully capable to prepare and respond to COVID-19, I am, at this moment, declaring a state disaster for all counties in the state of Texas. Now, pursuant to this state disaster declaration, there will be many directives issued by this office over the coming days. Here are a few. This will authorize the use of all available and necessary state government resources to help prepare and respond to COVID-19. This will give the Texas Division of Emergency Management the ability to reassign and fully utilize personnel where they are needed the most. This will provide the immediate ability to move resources around the state, including resources obtained through the Strategic National Stockpile. This will empower the Texas Attorney General to pursue cases of price gouging and ensure that offenders are prosecuted to the fullest extent of the law. And my office can approve the waiving of state laws that hinder state agencies' ability to respond to COVID-19. A few more things. A key focus in our response is to prioritize protecting of the most vulnerable populations who would be most likely to contract COVID-19. As a result, I am directing state agencies to restrict visitation at nursing homes, state-sponsored living centers, hospitals, and daycares. This directive allows limited exceptions for things like end-of-life visitation and requires all individuals to go through the proper screening. We want to make sure that we do all we can to prevent this vulnerable senior population or others in hospitals from being contracted with COVID-19. I'm also directing state agencies to restrict visitation at prisons, jails, and juvenile justice facilities. My staff remains in constant contact with all of those facilities as they work on establishing best practices protocols. I'm also directing state agencies to take any action necessary to facilitate telemedicine. In addition, I'm directing state agencies to provide flexible work and telework policies to employees to give them the ability to care for their families while ensuring the state government continues to function at full capacity and provide all necessary services. This means, in addition, that anybody who thinks or feels or believes that they are ill in any way, they need to stay home and work from home. You may have the flu, you may have some other infectious disease, or you may have COVID-19. We don't need people who are sick coming into work. Now, one byproduct of having more people work from home, whether it be people who are working or whether it be students who may be in a school that would be temporarily closed or college or university, that it will increase demands upon the internet bandwidth. With this increase of work, we need to be able to make sure that the increase in bandwidth usage is met. As a result, in typical Texas fashion, the private sector is stepping up. I applaud what AT&T just announced, that they are waiving internet data usages for any customer who does not have unlimited home internet access. Now, the state of Texas will continue to take preventative measures and work with our federal and local partners to contain this virus and to keep Texans safe. During this time, we need all Texans to do their part to help the state respond to this situation. That means doing things like being extra vigilant about washing your hands, disinfecting frequent touches, avoid shaking hands, and staying at home if you're feeling sick. And I want to be clear. There's absolutely no need to go out and stockpile supplies. This isn't a type of situation like what we see with an oncoming hurricane where you may be without supplies or you may need to stock up on wood or water, whatever the case may be. There's no need to stock up on water, no need to stock up on these other supplies. There will be plenty available. For those who may be worried about seeing empty shelves at their grocery stores, these shelves will be replenished.
You've been listening to Governor Greg Abbott holding a news conference with major news for the state of Texas. He has now declared a state disaster declaration for all counties in Texas and is now making a lot of changes in order to make sure that the COVID-19 response is adequate. The main thing that he's talking about that I got from the press conference just now is that they're going to begin restricting visits to hospitals and nursing home facilities, daycare centers, prisons, jails, juvenile justice facilities. So they are now restricting the movements of people within the state of Texas.
He gave us some numbers as well, 39 confirmed cases. He named a lot of counties, some around the Dallas area, some around the Houston area. He did not name Bexar County. So actually there would be at least 40, but he said those numbers change all the time. 75 Texans are being tested for the COVID-19. He did also mention that Somewhat breaking news that San Antonio has opened the first drive-through testing facility in the state. He's also working with Austin and Houston and Dallas, but San Antonio has that first drive-through. He said he didn't have any information on how well it's working because it just opened up just a matter of minutes ago. He said, but right now it's for first responders, healthcare workers, and high-risk patients. But obviously the state is doing what they can to combat the coronavirus in any way possible.
We're going to head back to Austin and get some more of this news conference. A lot of breaking news happening there. Let's join in again.
For this, Texas prepares for many disasters all the time, and this is no exception. And we know that we have the capacity to be successful in meeting the challenge of COVID-19. I want to talk a little bit about some good news, if you will. One of the things that CDC has done has changed some of the recommendations that will allow us to conserve some of the inventory that we have of certain types of supplies that are used in healthcare, and also to help expand the capacity to do testing. I know that testing is a great topic of interest, and as the governor said, we have essentially two mechanisms for people to get tested. One is through the public health system, and the one that is rapidly expanding now is the private lab system. I feel that I can really give you the most details on the public health system side of it. Here, again, as the governor said, we have several public health labs in the state that are online and able to do testing. Currently, we believe the capacity to do that testing is somewhere around 270 individuals per day. And one of the things that has helped to improve that capacity is the changes, again, that the CDC has made in terms of the types of specimens that we get from the patient and have them tested. So that's really good news. Still, in Texas, through the public health system, we want individuals to contact their doctor. We want their doctor to contact the public health system and determine whether or not testing is suitable. At this point in time, the criteria that we'd use for testing would be that an individual, including healthcare workers, has symptoms. So we don't recommend and we aren't able to test people who do not have symptoms, and but in addition to that, has had close contact with a confirmed case, has traveled to a location with ongoing COVID-19, has risk factors for poor outcome if they were infected with COVID-19, or they're hospitalized with fever and symptoms suspicious of COVID-19, even if they do not have those known risk factors. So that use of our public health resources is what we need in order to maintain our surveillance at a public health level and to be able to respond to this appropriately to this outbreak. I won't necessarily provide any more details at this time, but I know later we'll be answering questions.
Thank you. And now, Chief Dimkit.
Thank you, Governor. I'd like to remind everyone, Texas is no stranger to preparing for, responding to, and recovering from disaster. For this event, while it may be a new virus, novel if you will, it's the same people, policies, and procedures that we have used for decades to serve and protect Texans. Over the last several days, we've been working with our local emergency management directors, the mayors and county judges in Chapter 418 of the Government Code, to make sure they understand the capability of the full resources that are available to them. We've asked them to inventory their personal protective equipment and to continue to report that back to us so we can make sure that all needs are met. We've asked them to dust off their continuity of operations plans to make sure that we have the right resources available and that we're giving the key service to Texans that are needed. We've also asked them to send us the regulations that might need to be waived, as Governor Abbott mentioned. We will collect those and make sure they're reported back. Communication is our key during this event. And then finally, I'd like to again thank the City of San Antonio for getting that testing facility up so quick.
Absolutely. We'll take a few questions.
Governor, how do you make sure that the health care situations, the emergency rooms, don't get overwhelmed?
That's one thing that we constantly work on. And again, let's go back in time. We began working and planning for this back in January. And this is just a constant step-up operation process where Dr. Hellerstedt and other public health leaders in the state of Texas are working in conjunction with local health authorities to make sure that we will continue to have that capacity.
Setting up alternate facilities in case emergency rooms do get over trailers, or where we go for COVID and emergencies for other places?
You're exactly right. We are prepared for all of those contingencies. I will mention one thing. that is along the lines kind of what you're talking about, and that is one thing that we are establishing today and next week are these drive-through testing facilities. But in addition to that, you may see other type of stand-up testing facilities. A goal with the testing facilities is to not have people who may have COVID-19 going into a healthcare facility being tested there, but instead being tested outside of those facilities.
So we can expect these pop-up testing facilities to start showing up any day.
The ones you can expect today in San Antonio, perhaps as early as next week in San Antonio, in Houston, and Dallas, and sometime soon in Austin, will be the drive-through, and then after that, additional stand-up facilities.
I was reading that concept in regards to all these closings that people saw yesterday and were reacting to and going, why are we doing this? I did some research and came across a CDC study that dates back almost 20 years now called Flattening the Curve. Is that what we're doing? And can you explain why all these closures, the school extensions and all that helps to flatten the curve?
Thank you very much. So the question is about flattening the curve, so to speak. What does that mean? It means that as a disease, particularly a novel viral disease, as we see, and we see in other parts of the world, has the capacity to spread very rapidly through a population. It's called novel because no population has pre-existing immunity to it, and pretty much everyone is susceptible. So the basic strategy is to make sure that we slow down the progression of that infection as much as we possibly can in absolutely every community in Texas. And so that's why the things that we're talking about are so important. I would like to also add that the things that have been done in terms of closing, I think we should put that in perspective. Many of the things that have closed are things that are, if you will, optional. They're leisure activities. We can afford to do without them when we're facing a serious situation such as we are now. And I think that there's great wisdom behind that. We do really want that decision to be made at a local level, but as far as the concept, there's some merit to that. The other point I'd like to make is that people need to understand that in order to protect themselves from COVID-19, they have to make sure that their neighbors and their friends and their coworkers can protect themselves against COVID-19 as well. We're really all in this together.
Do you think that curve is the curve being flattened? Are you confident that it's achieving its doing it?
If folks do what we're asking them to do, absolutely, we will flatten that curve.
Governor, does the disaster proclamation have any effect on the May election?
Not specifically. It gives us flexibility to address any issue that may come up.
Governor, have you, your family, or anyone in your office been tested?
No.
Governor, with the disaster declaration allow local governments to exceed the SPT rollback rate as was
Well, we'll have to take a look at it. Here's the deal, and that is, for example, locally, pretty much the only type of governmental entity that would be affected would be a hospital district, and they weren't subject to having their rollback rate changed. And so for the other jurisdictions, their resources are not foreseeably going to be taxed right now for these reasons. We have already received millions of dollars from the federal government already in our hands that we will be parceling out to various local communities to respond to this. In addition to that, as we speak, Congress continues to work on additional programs that could provide additional funding. And so right now, there are no unmet financial needs at the local level. We'll see what happens. Say it again. Traveling during spring break. Listen, it depends on where you're traveling to. Of course, with what the president has announced and what seems to be obvious, and that is it would be potentially not a good idea to travel internationally. Within the United States, you just need to be smart about what your travel is. Everyone needs to take their own personal responsibility for their health as it concerns the travel. Do they need to travel? What type of environment are they traveling into? Are they traveling into a COVID hotspot? Are they traveling to an area where there is no indication of COVID whatsoever? And so there's a lot of different issues that each person needs to make a decision about.
Last question, Bob Garrett. Bob Garrett, last
Instead of
question.
sending people home after they're tested, if you looked at all of what China is doing, which is testing on the streets for temperature, white blood cells, and CAT scans, and then taking them to arenas and stadiums to quarantine. I know there's difficulties with that under our Bill of Rights, but if you looked at that at all, because that's a real flattening.
Right. So what we do is we'll look at this along a spectrum, if you would, about where we are and where we may go. Obviously, with the number of people who have tested positive in Texas right now, there's no reason for anything like that. We will obviously adjust what a response is based upon the number of people who test positive.
Thanks, guys. We got to go. Appreciate it.
Number of test kits in Texas?
Thanks, guys.
It's a lot right now, a lot and growing exponentially.
Got follow-up questions? Shoot me a note. We'll get them answered.
Thank you all, and thank all of you all also. Sure.
Once again, you've been listening to Greg Abbott, the governor of the state of Texas, giving us an update on what the state is doing to help combat the COVID-19, the coronavirus. He has some experts there with him who are trying to team together and make sure that the public here in the state of Texas knows how to combat this on a personal level and on a state level. One of the things that he did mention again in that second half of that press conference was these new testing facilities that they have. The first here in San Antonio, it is a drive-through testing facility. They don't have a lot of results about it because, matter of fact, it just opened up a few minutes ago.
They're going to be opening similar drive-through facilities in Dallas and Austin and Houston next week. I think he said Austin even sooner than that. It's an effort to keep people from visiting clinics. They don't want people who think they should be tested to be walking into hospitals and clinics, which is one of the main reasons behind the drive-in testing facilities. And in that vein, he's also saying that nursing homes, daycares, hospitals, prisons, jails, juvenile justice facilities, all of those areas that have group homes or places where people congregate for long periods of time, those are now going to be restricted to all visitors. So they're encouraging you, if you need to get tested, you're going to probably want to go through one of these drive-through clinics that, again, the one in San Antonio opening up just a few minutes ago. John Hellerstedt with the Healthcare Services Commission saying that they're expecting people to come be tested if they already have symptoms, they have been in close contact with someone who has tested positive, they've traveled to an area where there has been an outbreak, they have risk factors, or they're already hospitalized with a suspected case.
And one of the things that he did point out is what people are asking, not just in the county, not just in the state, but all over the country, is how do I get tested? Should I get tested? And where are these tests available? One thing that he did say that the public health system, he has some numbers on that. Right now in the state of Texas, through the public health system in the state, they are able to test 270 patients per day, but that's just through the public health system. There are also some private labs that are also being able to do tests here in Texas. But right now, 270 per day, said that will increase over time, and they will be in the thousands, hopefully very soon, as far as those tests are concerned. But if you do not have symptoms, they ask that you do not try to take one of these tests, because they're trying to save these tests right now for those people who are showing signs of symptoms. Once again, he did declare a state of disaster for the counties in the state, and that means that they can use all the state government resources that they have they can move them around, they can use them however they need to. One thing he did point out, we've noticed that just on your everyday shopping, going to the grocery store, that the shelves are empty for a lot of hand sanitizers, for a lot of toilet paper and paper towels. And the governor did point out that they're going to be taking care of price gouging as well. So if you know somebody or a company or a store that's that all of a sudden the inflated prices are for those things that you need, those cleaning products that you need, that's going to be taken care of as well. So
there's a state response to a lot of things that are going on right now. Part of that declaration is that they're going to be able to take all of the state services and resources and reassign them and all the personnel as needed. So things are going to be shaken up a little bit in the state government. One of the things they're asking is that the state begin teleworking. In other words, sending people home to do their jobs from home so that they can stay home and take care of their families. They want to make sure everyone stays home, particularly if you're feeling sick. And to that end, because so many people are going to be on the internet and they're going to be trying to do their jobs from home, they're working on widening the bandwidth on the internet so that people in Texas who are going to be working from home are not going to crash the system, which has already just happened. We were going to give you for instance, an email address for you to go to a website and get some information from the Department of Health and Human Services, but that has crashed because so many people immediately logged on to get information. So they're going to be widening the internet broadband width. AT&T also announcing just now that they're going to be adding unlimited data to make sure that everybody can get data at home.
Another thing that people are obviously concerned about is the cost, especially if they have this test taken or that they're trying to recover from the coronavirus. One thing he did talk about was getting insurance companies to waive the cost when it comes to those items that you need to help recover or even the test for the coronavirus. He also talked about the public health system. And if you don't have insurance and if you're limited on your amount of insurance, you can call your 211 and they will give you some assistance on where to turn and how to get these tests if you don't have insurance or if you're limited on the amount of insurance you have. But once again, they are working with insurance companies, trying to get these insurance companies to just basically not worry about the cost when it comes to the coronavirus.
Right now, our newsroom is working on getting the location of that drive-through. We will bring that to you as soon as we know what it is. But again, they're not asking you to drive up if you don't have symptoms. You really do need to already be a suspected case. They in particular want to make sure that it is available for first responders, people who are in the healthcare industry. That way, they can find out quickly and easily without entering their workplace potentially with symptoms. And so that's mainly what those drive-throughs are for. They're not just for the general public. If you're curious, they really are to keep our first responders, our healthcare workers who we need so desperately right now to be healthy, to have a one and done, find out if they have it, and then they go on their way.
Once again, we want to mention the fact that earlier today, that our Mayor Nuremberg held a press conference and announced that we do have one case of coronavirus, one positive test here in San Antonio. It was not community spread. It was a travel case of coronavirus. And he also made a point to talk about that. And he made a point to talk about the fact that they are now implementing the emergency system here in San Antonio. No groups of over 500 can meet, at least for the next 7 days. They also recommend that no groups over 250 meet, and they will reassess that after that 7-day period next week when they meet with City Council. But right now, no group over 500 is allowed to meet here in San Antonio.
A lot of changes, like the governor said, as his parting comment on his way out the door just now was, it's a lot and it's growing. And we are going to be here to bring you every new development as it happens. We'll hold your hands. We'll all hold hands through all of this. It's something we've never lived with before, never gone through before. A very historic moment in San Antonio, but we're in it together and we will keep you informed. We have a ton of stuff on KSAT.com right now. If you just want to go on there and educate yourself and browse around.
All right, we'll be back with a look at the weather coming up with Katie Blake. Ooh, it's warm, it's humid.
Yeah, springtime in Texas.
Is this a bad hair day?
Yeah, kind of. Sorry. We're here to tell you,
Okay.
Yeah.
We tried. We tried.
It's warm and muggy out there, and that's not really going to change through the weekend. Better rain chances don't kick in until early next week. So we got a lot going on today, a lot going on this weekend. So one thing that you really don't have to be overly concerned about today is the weather. So let's walk you through it, let you know what to expect. Something that may be giving you some trouble today, that is the pollen count. Both oak and mold are high today. So a double whammy there, but mulberry and hackberry are low. Look at our temperatures. We're starting to see a bit of a spread in our temperatures thanks to the cloud cover. Much warmer off to the south, 81 in Cotulla, 72 here in town at the airport, still in the mid to upper 60s in the hill country. And here's a look at where we stand cloud cover wise. We had a lot of low clouds and mid and high level clouds around this morning, but the lower deck of clouds is gradually starting to erode. So places that have lost that low cloud cover, you're starting to warm up, like Cotulla in the low 80s now. Here in town, look, you can kind of see that cloud deck, that low cloud deck eroding from the southeastern part of Bexar County. It's kind of cutting the county in half right now and will continue to erode off to the northwest over the next several hours. So we'll gradually start to see a little bit of clearing. I think we can see that line here of those lower clouds right here on live cam. This is our view near 410 and the airport there. So a little bit of clearing, but even as we lose those low clouds, there's still going to be a lot of that high thin cloud cover continuing to stream in overhead today. So even as we start to clear out a little bit, you're not going to see a ton of blue sky as we head into the afternoon hours. High temperatures today, low 80s here in San Antonio because we've been under the cloud cover so far. You saw that spread in temperatures. If you're already in the low 80s, you could easily jump into the low 90s by the end of the afternoon. So there will be a big spread in temperatures today across the area. Just keep that in mind. Staying warm and humid this evening with just plenty of cloud cover around. There is no chance of rain in the forecast for today, however. That's not the case up in North Texas. They've seen a lot of rain up closer to the I-20 corridor so far today. Unfortunately, we will not be tapping in on any of that. There's a frontal boundary getting ready to stall out up in North Texas, and that will not be moving to the south and will not be helping us out with rain chances. So we've got that going on. But further to the west, there's an upper level low pressure system that is spinning over Southern California. This is what has been tossing us all that cloud cover over the past several days and what will continue to keep us cloudy today into tomorrow. Unfortunately, this upper level low is going to bring some rain to North and West Texas. Not really going to help us out very much as we get into this evening and then into Saturday. You see more rain for far North Texas and even into the southern portion of the plains by tonight into early on Saturday. So here's tomorrow morning. We'll start off again with overcast skies with more active weather off to our north. Saturday and into Sunday, there'll be a surface low pressure system beginning to develop with yet another frontal boundary coming out of North Texas by Saturday evening. Now we have one forecast model, one of our higher resolution forecast models that is just certain this frontal boundary is going to make it down into our portion of Texas. What that would do, several things, maybe give us a few more showers, cool us down pretty significantly for Sunday, and also bring in some drier air. Not all of our forecast models agree with that scenario, but this particular model has latched on to that and has been pretty consistent over the past day and a half or so. So this is something we're watching with each new model update here. We're watching, and Adam Caskey will have more updates for you this evening. Sarah Spivey tomorrow morning. So keep checking back with us because that could make Sunday a cooler day. Tomorrow definitely warm once again, mostly cloudy, but we could maybe even see a couple more showers, and Sunday could potentially end up being a cooler day. Better rain chances tapping in next week. Scattered showers and non-severe storms will begin to work into the forecast by Monday. It'll likely hang around through the end of the week, and that is good news because we definitely need some rain.
Definitely. It looks like a real week of spring right there.
We need some March and April showers for our Mayflowers.
Yes, for sure. And a clarification when I said we're all going to hold hands and get through this together. I meant virtually. Please keep your distance. Social distancing is the key.
Thing, right?
Boom.
The elbow thing.
Boom.
Holding hands. We'll be right back. Mike, Fiona, the SA Live gang packing up and headed out to a spring break hotspot.
But it's not just a great hangout for spring break, is it? Mike and Fiona, where are you headed today?
Well, you know it as a spring break hotspot, but you know what? There's still so much to do and so much fun to be had in South Padre Island after spring break.
Yes, indeed. We went down there recently, and oh my goodness gracious. First of all, the beach. It is known for that sugary sand, and what is better than horseback on the beach?
Yes, find out what happened.
No horses were harmed in doing this. I don't know
we
about
might have
us,
been, though. And of course, sand sculpting. You mentioned that sugary, beautiful sand. It's one of the best beaches in the world to do sand art.
And some great tips on how to do the perfect, not just, making a little sandcastle, but something really, really artistic.
Yes, and shiver me timbers and walk the plank. We ran into some pirates. and we learned Pirate
And we learned how to be
101.
pirates. And no pirates were harmed in that either. Hey, of course, South Padre is known for all the sea turtles down there. They have a sea turtle sanctuary and rehab area, and Jen got to go with them as they release some of the sea turtles back out into the wild.
And of course, we take a look at places to stay, great places to eat and enjoy the food.
Yep, that and a whole lot more, plus surfing down there because there were some waves kicking up. So that, as we head down to South Padre Island, that's coming up on SA Live.